Welcome to the Fifth Avenue Doctor's Consultation on Cosmetic Surgery and Dermatology with Dr. Louis M. Feder, board-certified dermatologist and cosmetic surgeon. Dr. Feder is the author of About Face, published by Warner Books, and is the host of his long-running cable TV show, Here's Looking at You. Dr. Feder has also hosted a series of nationally broadcast skincare specials with John Davidson, Juliette Prowse, and Richard Bay.
Hello, I'm Dr. Louis Feder. In recent years, the fields of dermatology and cosmetic surgery, or as I like to call it, appearance medicine, has undergone exciting new changes. Just since 1987, when I released my first video on the subject, new and innovative procedures have been created. I am proud to say that I have participated in the development of many of these new and innovative techniques. But why has there been this explosion of new developments in the field of appearance medicine? The answer is quite simple. You have needed and wanted them. All over the world, people have come to realize they do not have to accept the appearance nature has given them. They have come to understand that looking good and feeling good really go hand in hand. When you are happy with your appearance, you are in a much better position to accept the challenges of your life, whether it's your professional or personal life. In this new competitive world of the 90s, we all need to be at our very best. You know, it wasn't that long ago that appearance medicine was generally available only to the rich and famous. But recent developments, especially in the fields of dermatology and cosmetic surgery, have reduced the costs and time required to attain dramatic results. Yes, the prospect for a better-looking you is just within everyone's reach. I can't begin to tell you about the incredible changes I have seen in my patients' lives because they made the decision to look as good as they can and should be. For some people, it's correcting severe flaws like acne scarring or other disfigurement or other skin abnormalities. For others, it's reducing the effects of aging and adverse environmental factors. And for those who have been fighting the battle of the bulge and other lipodystrophies and losing this war, amazing results can be achieved through what I call liposculpture. Developed in France by Dr. Pierre Fournier, it is not merely liposuction, but rather an active and dynamic technique that actually sculpts the body, and that I do entirely by hand and not by machine. I have operated with Dr. Fournier and have personally completed more than 2,500 cases successfully. It makes no difference if the results obtained are subtle or very dramatic. For that individual, it represents a change for the better. And it's amazing how one good thing can lead to another. A small change in the way you look and feel can change your entire outlook on life. And that can change how you relate to others and how others relate to you. Before you know it, your life can undergo a total transformation, and all just because you took charge of your life. But what are these new procedures? What can they do? What kind of results can I expect? These are the questions I am asked every day at my Fifth Avenue office, on my weekly television program, and at lectures I give worldwide. Well, that's what this new instructional guide is all about. It's your private consultation on the very latest procedures and advances in appearance medicine. Through the following demonstrations, I will show you the newest techniques that are available to help you change the way you look. I will show you how the procedures work. We will discuss expected results, recovery time, and I will even tell you about possible discomfort, if any. The more you know about a procedure, the easier it will be to make that all-important decision if it's right for you. So, let's begin. Here's a patient who had come to me 3 weeks ago for autologous fat transplantation of the nasolabial area and around the mouth. Let's go back and see that original visit at this time. Autologous fat transplantation is part of the greatest breakthrough in cosmetic surgery in the last 50 years. In so doing, a procedure that basically is a fat graft, I'm taking fat from this patient's right hip in a special manner in a tumescent technique. Tumescent meaning hard. By injecting special solutions, I can literally cause the blood vessels to stop bleeding, there's no pain, and I can get a hard surface where I can harvest live fat cells. I later take these fat cells, wash them, concentrate them, clean them of debris, and put them other solutions in to give them longevity. And after doing other procedures to them, I inject this fat into other parts of the face or body to rejuvenate areas that have been aged or have had trauma or things of that sort. In this particular patient, we're taking fat from this area and we mark it up in a manner like this. And after injecting the special solution and waiting half an hour and you applying ice, I will take this fat and re-inject it back into the face to rejuvenate areas that have been lost through the aging process. This is why in most cases facelifts are not necessary. Merely cutting and pulling skin does not replace giving back to the body what it already needs, that is fat. I compare this to a balloon. If a balloon loses air, do we put more air in the balloon or pull the skin of the balloon thinner? Obviously, putting more air in the balloon is the proper answer. And in so doing, in this case, we're putting fat back into an area which has lost its fat. In addition, 50% of the fat that I inject through this technique will be a permanent improvement. So after 2 or 3 times, and even sometimes even 2 times, this is a permanent correction of atrophied or loss of tissue. May I have the special opener and injection first. I will now inject a special solution into the area. I now will open the area to receive a larger cannula, and there's no pain at all during this procedure. As you see, the instrumentation is very mild, very blunt, very thin, causing no irregularities, and there's literally no pain. I will start to expand this area now with several injections of this material. Good. Now I wait about 30 minutes for the area to harden and for the blood vessels to close down, and there will be almost total anesthesia in this area with no pain or discomfort. Now the tissues have already been hardened, and I'm already harvesting fat from this patient's right buttock. And this fat, of course, that will be washed further and cleaned, and the patient cannot reject this fat. This is her own. This is basically a fat graft of live fat cells. Just like we graft skin, we're grafting fat. And in a period of time, this improvement to her face, after I inject it, will be a permanent improvement by up to 50 and 60%. Now, in addition to using this fat before it's further treated, I can take additional amounts of fat and freeze it to be used at a later date for the patient's facial augmentation. At present times, we have over 1,000 patients' fat frozen in our special freezers to be used at a later date. Of course, only the patient's fat that is frozen can be used again on that same patient. That is, one patient can't share another patient's fat for obvious reasons. Now, in this case, notice again how clear and creamy yellow this fat appears after being washed and concentrated. Now, in addition to doing autologous fat transplantation or live fat cell transplant to the face, I'm going to inject the nasolabial areas. I'm also will be injecting at that same time from that same opening site what we call the marionette line, which is around the mouth, the perioral area, which also seems to exhibit atrophy very frequently in the same way the nasolabial area does. So this is bilateral. I've already marked this out in a special marking pen. At the same time, this patient is also going to have liposculpture about the neckline. She has a bit of a double chin, as you can see here. I've already marked it out. So by liposculpting this area, literally without any incision mark, I'm also going to do liposculpture about her jawline, about the mandible in here. So I'm coming from 3 sites, one site here, one site in front of each ear, and literally after one tiny suture is put into these sites, one will not even be able to tell how I was able to perform this surgery. There'll be almost no bleeding, and there's almost minimal pain or the slightest amount of discomfort. So as you can see, she's already marked out, and she's ready to be treated. Now, we've already made a small opening site at the area next to the mouth. And I go in now with my fat. Open your mouth, please. And I inject into this area, fill the nasolabial area up. And from the same site, I fill up the marionette area. And then we will go ahead and I will liposculpt the neck after finishing off the left side of her face. I inject as I withdraw my cannula. And from one site, on both sides of the mouth, I can literally do the entire face. There is no pain here and no discomfort. The patient will be back to her work within a day. We apply ice, give the patient some prophylactic antibiotics, and this will be one very happy patient. Other areas that I can augment is the glabella area between the eyes. Sometimes I put together areas such as the cheek area, the malar prominences, to build up cheekbones. Also, there's usually very often a depression around the jawline. I can build that up. And even the chin, I can build that up because this particular way I do this procedure, I have a manner in which I can remove the periosteum, which is a covering of the bone, and allow fat to live and become a graft right against the bony tissue itself. So I can build it up. Fat has also been used in such diverse areas as the breast. We can use it in the private areas of men and women. We can do it for hand rejuvenation, and a host of new and wonderful new techniques are being developed with the use of autologous fat transplantation. Now let's see how she looks 3 weeks after the procedure was done. Notice we improved the nasolabial areas, around the lips themselves, and the marionette lines, which are the perioral areas. I think you have a wonderful improvement. I'm very happy. I certainly hope you are.
Yeah, I'm happy about that.
Thank you. And now let's go to some other photographs of patients who've also had autologous fat transplantation. This 64-year-old lady consulted me for facial atrophy and facial rejuvenation. After a full autologous fat transplantation to the nasolabial area and the lips, in addition to a chemical peeling, we note in the post-operative how attractive this lady is now. This 78-year-old lady consulted me for facial rejuvenation initially. We did a mini lift, a chemical peeling, and autologous fat transplantation to her face. She then discussed the fact that her hands looked very tired and weathered. We performed autologous fat transplantation to both hands and a hand peel, and 10 days after the procedure, the post-operative photographs are self-evident. This is a very happy patient. This 80-year-old lady consulted me for facial rejuvenation. When we explained to her that a facelift would not be necessary, and we performed autologous fat transplantation and the chemical peeling, this patient appears more youthful and is very, very happy. Autocollagen is another modality which is used to fill parts of the face. Here it is being injected in a 54-year-old man with nasolabial depression. Autocollagen is made from the fat which has been previously extracted from this patient's hip. This is a painless procedure, and the patient cannot reject this fat, being that it is made from the patient's own body tissues. This will last anywhere from 6 months to a year and a half. Autologous fat is longer lasting than autocollagen, as we are injecting actual live fat cells. In autologous collagen, however, being that we break the fat cell up for more superficial filling, this is not a permanent procedure and will last anywhere from a year, as I mentioned, to a year and a half. Autocollagen is useful for more superficial tissue defects than we use for autologous fat transplantation, which is primarily for major and deeper defects such as the nasolabial area and the glabella area between the eyes. Here's our patient now, and then 2 weeks later, and we can see the marked improvement made by the autocollagen. Here's another patient in her 40s who has had autocollagen in a period of 2 weeks, both before and then the after. Here is also another patient before and after being filled with autocollagen. Chemical peeling is one of the most important adjuncts in cosmetic plastic surgery. There are many different levels of peels, from the most superficial, which I often call a complexion peel, to middle-level peels to deep peels. More doctors today are avoiding the deeper peels because other things can be accomplished using a lighter peel or a middle-level peel over a period of time without the downtime or what we call the marble facies, which can occur with the deep peels. When I say deep peels, I'm talking about phenol or carbolic acid, which is reserved really for the much older patient with some severe sun damage or scarring. Here's a young lady who has a low-grade acne problem and has some large pores, and today we're going to do what's called my middle-level peel. My middle-level peel is a combination of several different acids, including trichloroacetic acid and Gessner solution and other things that I've used over the years to give a patient a very enjoyable experience after this procedure is done. It's relatively painless. It takes about 20 minutes to a half an hour to do. The recuperative period is about anywhere from a day and a half to 3 days, but usually less. There's no work to be missed when a patient has one of the middle-level peels done. Now, an important consideration is the fact of pigmentation. Most patients have no problem. I've done this particular peel on patients of every racial and pigmentary group imaginable. Hyperpigmentation, which is darkening of the skin, can occur in some patients, but if there's any question about that, you can always test the patient behind the ear. In fact, this patient has had this procedure done about 6 months ago. Her acne is under good control, but it's also a refining type peel also. So we'll begin that procedure right now. This procedure is almost a mini facelift. And the reason I'm saying that is that the young to the middle-aged patient usually does not need to be cut around the ear and have the skin pulled back. Many patients just need a little augmentation with some fat in the glabella area or nasolabially. And actually the last thing a patient would need would be a facelift to improve that, because a facelift cannot per se make that better with an incision around the ear. So the patient today should consider these different avenues with their cosmetic surgeon. For example, chemical peeling, middle level and middle and perhaps deep, dermabrasion or a combination thereof, the operation that I pioneered called chemodermabrasion, the live fat cell therapy, of course home remedies to take care of the skin, the glycolic acid concept, retin-A. In addition to that, proper exercise, nutrition, vitamin therapy, exercise. These are things that must be engendered and must be kept in mind at all times to maintain a youthful, healthy appearance and to have maximal beneficial health. Now let's begin this procedure right now. We're going to begin now for this patient's problem. She has mild acne and large pores, and her skin responds particularly well to the middle-level peel. This patient has been pre-treated in the past with some of our glycolic products as well as retin-A and other things we've been doing on her. So now we're first going to take off some of the superficial stratum corneum using some acetone. So as you see, I'm just cleaning off that face in a circular motion. This will be relatively painless. Sometimes the smell is a little strong, but that's about the extent of the situation here. And of course, recognizing that chest can be painted, hands, arms also need chemical peeling. So now she's been made basically degreased using the acetone. Now we go to a special other solution. We're beginning the use of our first group of solutions right now. She'll take about 10 coats of that. The patient is holding a fan in front of her because it gets a little discomforting, but not bad. It's tolerable, and this seems to take away some of the discomfort by so doing. We cover the entire face, even around the eyes, the periorbital areas, the nose, and I even do the lobes of the ears to ensure uniformity. We come down to the angle of the jaw, and we go to our next coat. We'll do about 10 different coats of this one acid first, then we go to our second acid solution. As you see, a frosting is starting around the patient's malar eminences, the cheeks in here. This will go away very shortly, and the patient will be more or less fully healed within 2 to 3 days, even less. She'll hardly miss any work. This is the last coat. our first treatment solution. I've covered the entire face, as you can see, including earlobes, down to the angle of the jaw, the perioral area, which we are now. This is the perioral area. Then we go around the orbit itself to the malar prominence, or the cheekbone. We cover the nasal area, and of course the forehead. Right into the hairline. I think it's very important that when one does a chemical peel like this, one goes into the hairline for blending. You don't want a line of demarcation. That's very important, and I often teach this at chemical peeling courses that I give. We're beginning now on the forehead, the final solution of a trichloroacetic acid solution in a special base that we've developed. This special solution modifies the effect of the trichloroacetic acid so it doesn't go too deep, but yet it causes the amount of desquamation that I want. We're again covering the cheeks, coming down to the angle of the jaw, across the mouth, the upper lip. I go right to what's called the vermilion border, the nose. This is the glabella area. Again, to the malar prominence, down the sides of the face, blending into the hairline, and the earlobes, and now we're finished. My nurse will now put on some gauze pads that have been impregnated with a special solution to make the face feel more at ease. She will follow this with a special cream and some ointments that the patient will be instructed to use at home. I will see her again in 3 days, and I expect a very bright, clear, smooth complexion. 1 or 2 of these type peels a year, depending upon skin type, can ensure a very beautiful, clear skin. And now we're back with the patient. It's been 2 weeks after we've completed the middle-level peel procedure, and as you remember, she's had moderate acne. You'll see her complexion is markedly improved, and she is breaking out less. Am I correct?
Yes.
Yeah. Not only that, the patient will probably have to have further treatments such as a middle-level peel or perhaps dermabrasion if the scarring persists or gets more severe. But that will be determined at future visits. And now let's look at some other patients who've had this procedure done. This 38-year-old lady had a very weather-beaten and unattractive appearing facial expression. On examination, the solar damage caused by prior sun exposure was very evident. We did a middle to deep chemical peeling on her, and this is how she appeared 2 weeks after surgery. This 53-year-old lady had severe wrinkling, hyperpigmentation, and a very mottled appearance of her facial skin due to both the aging process and severe sun exposure. After a chemical peeling using trichloroacetic acid and phenol, this is how she appeared 1 month after surgery. This 57-year-old lady had a very fair complexion and had severe sun exposure over many years. We decided to perform a middle-level chemical peeling in addition to some autologous fat transplantation. In addition, her lips were also augmented, and the post-operative photograph will show the excellent results that can be achieved. Chemodermabrasion is a procedure that I pioneered and introduced to the medical community more than 15 years ago. I, to date, have done more than 4,000 of these procedures. It is quite a unique procedure in the fact that I have combined chemical peeling and dermabrasion as one procedure. In this 1-hour operation, one can achieve anywhere from 75 to 95% improvement and better for acne scarring, active acne, facial damage caused by sun, or trauma. In addition, excoriations, which are scratches on that may be self-inflicted, can also be corrected with this procedure. This procedure heals in anywhere from 7 to 10 days, and the patient must keep out of the sun for 6 months. But other than that, the healing is usually uneventful. It can be done in any pigment group, such as white patients, of course, black, Asian, etc. We initially apply an acid, which I make fresh that morning of the surgery. We apply that for anywhere from 3 to 5 minutes. Then it is neutralized. A full face dermabrasion is performed under local anesthesia, with anesthesia already injected both into the face and the anesthesiologist having injected anesthesia intravenously at the same time. After the procedure is done, another application of a different acid is applied, and different dressings are then placed on the patient's face. There is almost no pain and no memory of the actual procedure using this type of treatment and anesthesia. Let's discuss our first cases of chemodermabrasion. This 24-year-old female came to me for the scarring secondary to severe acne cystica. Not only was the scarring present, but the patient had ongoing disease. We chose to do chemodermabrasion on her. The result has been an improvement of perhaps 90%. The patient is happy, and other members of her family who've had similar conditions have also been treated in this manner and have also responded beautifully. This lovely lady had a large amount of sun exposure. She lived in Florida, and as you can see, she had areas of hyperpigmentation, some fine wrinkling, and some early keratoses, which can be precancerous. We also elected to do a chemodermabrasion on her. She healed very beautifully, and we can see the post-operative results. She looks younger, fresher, feels much better about herself too. The skin looks just wonderful, and I see her from time to time now in the future, and the condition has just improved by at least 90%. Liposculpture is the new method to mold the body into a more appealing form. Areas that can be treated include the ankles, the calves, medial and lateral knee area, medial thigh, the saddlebag area in women, the abdomen, love handles in men. In addition, the arms can be done with sculpture, as well as the neck area and even the posterior neck, where we see a buffalo hump deformity on some patients. Almost every part of the body can be molded in this way. In fact, we are doing mega liposculpture to help some people reduce their severe obesity. But that is the subject of another tape. People also ask, what does one do with the tape, with this extra fat? What we can do today is take this fat, wash it, treat it, remold it, and reuse it back in the body into areas, for example, in the face, as we mentioned, the nasolabial, or to build up the cheek area, earlobes, to make the hands more improved. These are some of the wonderful ways we can basically recycle the fat from one part of the body to another. The tumescent anesthesia technique is also a major breakthrough. We use large dilutions of sterile water, xylocan, and other solutions to literally blow out the area that we're treating. It causes literally no pain, there is no bleeding, and we can sculpt the entire body by using the tumescent technique. I also use this technique for dermabrasion, but it is mainly a particularly wonderful treatment with liposculpture. Tumescent technique allows us to do treatments under local anesthesia with no pain, no bleeding, and total safety. Other breakthroughs include the fact that doctors now can have a table in their operating room, as I do, where a patient can be checked every few moments by raising the table up, and I can do liposculpture with the patient standing while they are in a harness position, so I can make sure that the liposculpture technique is progressing exactly the way I want to. Because when a patient lies down, gravity does not allow us to see exactly the kind of result we're getting. Computer imaging is another help for our patient, because I can give the patient an idea of how they will look after the treatment is completed through the computer imaging methodology. Some of you may wonder why I call the procedure liposuction liposculpture, because it is just that. Liposculpture is the active, dynamic process of molding and resculpting the body into a more pleasant, pleasurable form. Liposuction, in my opinion, is merely a passive sucking technique, very often done with a machine. I do not use a machine. I do all my work by hand, by syringe, which was invented by Dr. Pierre Fournier of Paris. And I've worked with him on this technique. And as you see, I do it all by syringe, which gives me the same amount of atmospheric pressure for suction as a machine does, but with very little trauma. I never get the irregularities and ridging as seen with a machine. This is a much more gentle, more physiologically correct method of doing this wonderful new process that I've termed liposculpture. As you can also see, the cannulas that I use are very thin, and as a result, they disrupt the body's architecture minimally. And we do not see the collapse, ridging, and irregularities reported after surgery by some physicians. This French technique, originally developed in Paris, allows me, under direct observation, to make a small opening site with a sterile ice pick behind the knee area. And coming in, and under very careful guidance, I am literally molding out these sites very slowly and carefully without the interruption of a very high-powered machine, and enabling me to do a sculpting procedure as a sculptor would do a statue. Now also, if I were doing the neck area, this is a different way to liposculpt. I would be coming in at this area right here, below the ear, on both sides, and I would be sculpting the neck area without an incision. Remember, this is being done without an incision behind the ear. And literally after 4 or 5 days, this patient is perfectly healed. She'd wear a special dressing for 4 or 5 days, just like she would if I were doing the knees or the abdomen. Of course, if the knees or abdomen, they wear a special girdle. But all we would have to have here is a special dressing to remold this neck, and I could probably improve a neck if, in the average patient anywhere from 60 to 90% with a 45-minute procedure. It's safe, it's cost-effective, and it's painless. Now let's look at some before and after photos of some patients. This 32-year-old female was very active athletically, but she could never lose the extra fat in the areas of the saddlebag, or which is known as the corvette de cheval. We performed the French liposculpture technique by hand, and we sculpted the area around the knees and the hip area. The post-operative photographs reveal a much more contoured, sculpted patient who is extremely happy. This 27-year-old female exercised and dieted over a period of 3.5 years, but she could never remove the areas around the hips, thighs, and buttocks. Under local anesthesia, we performed body liposculpture using the French technique syringe method only, no machine, and the results have been superb. This 35-year-old executive exhibited one of the most troubling areas in cosmetic surgery. The area around the chin is almost impossible to remove through dieting alone. Using liposculpture surgery, we performed a procedure to refine the area around the chin and around the jawbone. As you can see, the results were very, very pleasing, and the patient is ecstatic about the results. Another procedure patients often ask about is the rhinoplasty or nose job procedure. In this case, is a 47-year-old woman who had a rhinoplasty done in addition to having liposculpture of the neck with a small chin implant. In this particular case, the chin implant was achieved through the use of autologous fat transplantation rather than using a foreign body. One of the most frequent procedures I'm asked to perform on patients is lip augmentation. As one ages, it seems that lip tissue seems to diminish in quantity and quality. Many young women also request this type of enhancement, as well as men. We are going to approach this patient and augment both upper and lower lips. As you can see, this is a very beautiful woman. However, she has a little weakness of the upper lip compared to the lower lip. We're going to harvest fat from her right hip area under the special new tumescent anesthesia procedure, and there is no bleeding and there is no pain. We wash and concentrate the fat, remove debris, There is no incision, but merely a needle mark, and this procedure normally would result in a 50% permanent improvement each time it's done. Now this fat has already been harvested from her right hip. It's been concentrated, cleaned, debris has been removed, and now it's, as you see, it's clear, creamy white, very clean, and 100% pure fat cell. And basically this will be a graft. And being that the patient's own tissues, it can't be rejected, there can be no allergenicity, it's totally safe, and in the proper hands, this is a very lovely cosmetic procedure. Now, as you see, the cannula is very thin, it's very blunt, it causes very little trauma to the tissues, and as you see here with a small opening mark next to the lip, I will be able to thread this material into her lip, both upper and lower, with almost no pain. The whole procedure to inject in the upper lip and lower lip will take no more than 3 minutes. A small needle mark will allow me to open the skin, and I will go into the lip area, into the vermilion area of the lip, as well as the body of the lip, and fill up this area with fat tissue. And by so doing, from one opening right here, I can do the upper lip as well as the lower lip. There is almost no pain because there's also been anesthesia injected into her lips on both sides, and there'll be almost no bleeding. Open your mouth, please. After I've completed that, I go to the other side and do the same procedure there. We're just molding the area into place. This should be a wonderful take. There's literally no side effect, minimal swelling, and in about a day, day and a half, there's actually no problem. And over a period of a week, the overcorrection will subside. Now, as you've just seen, this patient's had autologous fat transplantation, and this is 10 days later, where we've taken the fat from the hip, we treat it in a special manner, and re-inject it back into the lips to give it a more attractive, fuller appearance. The healing period exists of perhaps 7 to 10 days, and there is no sequelae or basic discomfort. Live fat cell transfer therapy is perhaps one of the greatest cosmetic developments in the last 50 years. We can literally improve areas in the nasolabial, of course the lips, the cheek area, the glabella, what we call the marionette line, and improve and augment these areas which aging takes away. This has far much greater effect than merely a facelift for the patient who needs it, because a facelift cuts you here and we pull tissue. In this procedure, we are giving back to the body exactly what it lost, the fat tissue. Aging today comprises a loss of fat, not merely a loss of tone. Together, perhaps a facelift or a autologous fat transplantation is the most significant breakthrough, but many times the fat injection merely by itself is all that most patients will need. The blepharoplasty procedure, or what's commonly known as the eye lift operation, is frequently requested. In this instance, upper and lower eyelid surgeries were performed, giving a more bright, open appearance around the eyes. In this case, a chemical peeling was also performed for the hyperpigmentation surrounding the periorbital or eyelid tissues. A major breakthrough in rejuvenation is what we call our complexion peel, or our light chemical peels. Now, these involve a combination of glycolic acid and our special mixture of trichloroacetic acid. When combined over a period of time, this could literally rejuvenate, refresh, refine the skin. It's used, for instance, in acne. We use it also, as I mentioned, for skin and facial rejuvenation. We use it for hyperpigmentation, that is for darkening, which is what you have around your eyes. And it's also very effective for patients who've had too much sun damage, that is actinic or solar damage. This type of treatment we usually do once a week for 6 weeks, and thereafter you're seen every month ad infinitum, depending upon what your needs are. But we have patients who come literally every month like clockwork after the initial 6 light peels are done. And the nice thing is that these treatments are not expensive, and they may indeed be reimbursable by insurance as they are done for a medical problem that manifests itself on the skin. So we're going to begin now. First, we clean the face with some alcohol and some acetone. My nursing assistant will give me that special cleansing aid now. And we begin by cleansing the face gently, but certainly thoroughly, to get off all the sebaceous material and the skin oils. That's the alcohol. Now she'll give me an acetone soaked gauze pad. Thank you. Acetone is very drying. The patient may experience just a minimal tingling. Being careful around the eye area, not to traumatize the tissues. I also do the earlobes because the earlobes certainly constitute a part of the face, and a lot of women complain that their earlobes look tired. We also, as a sidecar, we also do injections sometimes into the earlobes with fat to make them look fuller and more attractive. Now I'm going to begin with my light application of my special glycolic, which is a time-based formulation, and my nursing assistant will begin the clock when I start to apply the glycolic. And she will begin with the clock now. Time is nearly up because we've completed the initial phase of the first peel. Now we neutralize this particular first peel in preparation for the addition of the second trichlor peel. Over a period of time, her complexion will improve markedly. Of course, she'll be using things at home, part of her home regimen of products that we've dispensed to her. She will avoid the sun, that is undue exposure, and she will use a sunscreen. Most importantly, she will avoid all sun exposure between the hours of 10 and 2. We will begin the second peeling now. Now we are beginning our second peel, which is a trichlor peel, which is not as much dependent upon time as the first peel of the glycolic. We begin in the superior forehead first and work our way down. Even in our light peels, we try to do cosmetic units one at a time. This area, for example, the forehead, we determine to be a cosmetic unit. I try in general to peel a full face, but sometimes we do it in cosmetic units. Now we go to the second cosmetic unit, which is the eyelids, the mid-face, the dorsum of the nose, and across the malar prominences, which are known as the cheekbones. Now we go lower to the upper lip, around the mouth, touching the angles of the jaw, and ending with the earlobes. There's minimal discomfort here. A little tingling is all the patient should experience. Then we'll neutralize again with water, but actually this particular peel is self-limiting. Now we're applying a very mild steroid cream to decrease some of the tingling and dryness, and the patient will be applying this twice a day for the next 2 or 3 days, followed by our moisturizer. But this is a very, very painless procedure, and the results over a period of time are outstanding. Patients tell us that they love doing these things because it keeps their skin looking at its optimal level with a minimal amount of discomfort and literally no downtime. They can go back to work the next day. And we make sure to keep the prices at a level that everyone can afford, as I'm sure most doctors doing this kind of work also do. And that's our complexion peel. To further comment on combination procedures, here is a 67-year-old lady who had autologous fat transplantation to the face, a chemical peel, as well as a mini facelift. As you can see, this is a very satisfied patient who is very attractive after this procedure. I would like to discuss a problem now that has perplexed both men and women for centuries. and that is varicose or spider veins, which primarily involve the lower extremities. They can, of course, involve the face, but the main problem that we find in cosmetic medicine today is the varicosities which are seen in the lower extremities. The main causes of these are perhaps standing, heredity, pregnancy, oral contraceptives, or a combination of all of those factors. The etiology, again, is not that well understood in the fact that we know that there's a weakening of the vessel wall. But there's a wonderful treatment for it called sclerotherapy. And what sclerotherapy does is basically cause the vessel walls of those superficial blood vessels to collapse so they're not visible to the naked eye. We can do that because the deeper blood vessels in the body bring blood back to the heart. So the superficial ones are primarily cosmetic in nature. What we're looking at now is a classic example of a patient who has varicose veins of the lower extremities before treatment. As you see, it is tortuous, raised, sometimes painful, and especially so when the patient stands, and it's classically very dark and hyperpigmented. As you see, there are some vessels around it which are reddish in nature, and those are tributaries of the large vessel. Now here's a patient who has rather classic findings. She tells me that she has pain on standing. They're getting a little more visible. And as we see here, there's a large blue blood vessel here, which is a vein. We shall inject that now. And around it, you'll see some pinkish, what we call telangiectatic vessels, which also can be treated both individually or sometimes they communicate with a larger blood vessel. We shall begin this treatment now. Now, this is the ethoxysclerol, which is a clear solution. It's in a sterile syringe, and we use a 30 gauge needle, which is very, very fine, so the patient will experience almost no discomfort with the injection of this. Now we first clean the area with an alcohol solution in a rotary motion, and we have the ethoxyschlerol in a sterile syringe with a very fine 30 gauge needle, so the patient will experience almost no pain or discomfort. It's a small little prick actually that you'll hardly feel. Now we are going to begin the injection itself. I hold the skin taut and I try to enter the middle of the vessel in such a manner. There's a blanching immediately as this solution is pushed through the blood vessel. And we start to inject a minute amount of material. Out we come and we put direct pressure on the area. And we wait for the next area to be treated. The patient will tell you there's almost no pain at all. Now we're in a different area now for this little red we call streamer, and we're going to inject this ever so superficially right in the vessel, and it's gone. Pressure, please. Good. That's a perfect result right there. And over a period of time, these will heal beautifully without any hint of any treatment. Other vessels may appear at a later date, but that for the most part is rare. And they also can be treated in the same way. Let's do another area right now on the other leg. Now we're in the patient's other leg, and as you can see, she has a large varicose vein right here. Now we're going to inject that also, and there's some large communicators right next to it. So we're in the vessel, we inject a small amount of solution, and as you see, there's a blanching almost immediately. This will be an excellent result. Putting some pressure on it, and then the patient will wear special support stockings for 3 days, which we give to the patient. In addition, we give the patient an increased dose of oral vitamin C, which seems to enhance and strengthen the blood vessels that we treat. And there are some isolated blood vessels also that we're also doing. Let's go back and examine these photographs of before and after treatments and what can be achieved through sclerotherapy for varicose and spider veins. Now, as we see here at the pre-treatment, it's a large tortuous vessel. And let's look at that 6 weeks after the start and how much it's improving already. Then let's look at the 8-week shot, and we notice more clearing, and the little fine pink vessels are beginning to disappear. And here is a picture at 20 weeks after the beginning of treatment. As you can see, the results are truly remarkable. Micropigmentation is a permanent procedure done around the eyebrows, eyelids, or around the mouth for patients who have to conserve their time, who may have arthritis, or who may have poor vision. It is done under local anesthesia after pre-marking the patient and is done with earth tones which match the patient's complexion. The procedure takes normally less than 1 hour and is relatively painless. The areas enhanced are in here, here, the lower lid, and a very fine line around the mouth to make the lips look fuller and more voluptuous. The procedure begins with a sterile marking pen. After that, we use this per-mark enhancer into the pigment. This has four very fine rotating heads, and we go right into the eyebrow or the eyelid. The color for the lips is usually a light pink and a very thin line, which is hardly noticeable at any distance. And let's look at some photographs of patients who've had this procedure done. Micropigmentation is one of the newer procedures which allow us to pigment the skin in the area of hair loss. As is noted here, the eyebrows look natural, using safe, natural pigments, and this is a painless procedure. This 35-year-old female had very thin lips and desired to have a more cosmetically pleasing effect. We did fat transplantation to the lips and the micropigmentation at the vermilion border, which is where the skin meets the lip tissue. This is a very satisfied patient. Many women and men have a problem with unwanted facial or body hair. Fortunately, there is a simple, safe, and effective method for permanent hair removal. We call it Kenetron. The procedure begins with the tweezers, which is electrostatically charged for a short period of time. The tweezers is then applied to a single strand of hair where minute electrical or radio current is transferred to the hair shaft and travels down to the hair follicle. The current causes the follicle to die and release the hair. No further hair growth will occur from that site, making this a permanent procedure in about 99% of the time. The procedure is generally painless, cost-effective, and offers a permanent solution to unwanted facial and body hair. This is an office procedure and is done frequently throughout the world. In addition to all types of cosmetic surgery that patients, both men and women, may need, quality skin care is essential to maintain the quality, the appearance, and the tone of the skin. In this patient's case, he's having a facial therapy by a licensed esthetician, which involves deep pore cleansing, the use of different quality items that can be dispensed by the doctor's office and his nursing staff and his esthetician staff. And in addition to the stimulation of the muscles, it's a very pleasurable feeling, as well as something that really is very helpful on a weekly or monthly level, depending upon the patient's needs. In this instance, the patient is having the kneading and the massaging of the muscle, as we see here, and after this treatment is over, we shall begin what's called the thermal mask, which involves the application of a kaolin type of clay mask, which removes the impurities of the skin, tightens up the skin tone, and leaves a very, very smart, very positive image to the patient's face. In addition to cosmetic surgery, it is most essential for proper skin care to use quality products, to have facial therapies, such as what you see here, where the patient is having special products applied during a facial therapy, which includes massage and stimulation of the muscle, and it's also quite pleasurable. So one must recognize that ongoing skin care is important to maintain a lifetime of a beautiful complexion and quality skin. Now the application of the thermal mineral rejuvenation mask is complete. We will wait approximately 25 minutes the mask will harden, and so doing will remove the skin's impurities, tighten the pores, and in general give a very healthy, youthful glow to the skin. This should be done approximately every 6 weeks to 2 months. Occasionally we do exolift also, which also removes the embedded sebaceous material that embeds primarily in the mid-central part of the face. Skin care is one of the most important parts of youthful rejuvenation for the skin. I hope this instructional guide has answered many of your questions. And more importantly, I hope you will now be in a much better position to take that first step in changing your life. All these new and exciting techniques were developed for you. You do not have to live with problem and aging skin and other abnormalities. You do not have to suffer with bulging thighs, droopy arms, heavy legs, or abnormal knees. You can eliminate varicose and spider veins, both of the face and legs. You can renew your skin's youthful luster and rejuvenate those aging and unattractive areas of your face, in most instances without a facelift. Chemical peeling, dermabrasion, and my pioneering chemodermabrasion are among the best-kept secrets in cosmetic medicine. Autologous fat transfer, that is the liposculpture of the face, is a major concept to be kept in mind. Before you begin, some words of advice. If after viewing this tape you are interested in any of these procedures that I've demonstrated, please remember that some of these techniques are quite new and represent the latest breakthroughs in cosmetic surgery and dermatology. It is very important that you ask your doctor if he or she is familiar with these new treatments. Do not be afraid to ask the doctor how many procedures they have done. Ask to see before and after pictures. And be sure your doctor is board certified and has an affiliation with a hospital. You can even request the names and telephone numbers of patients so you may ask them directly if they were satisfied with the results. In our office, we call these people patient consultants. Remember, every case is different. It is extremely important that the doctor gives you a realistic appraisal of the expected results. But most of all, be an informed consumer. And now a word about costs. The reason I have not included fees for the procedures that I've talked about on this video is because they can vary so widely around the country and the world. Individual operating costs, including office overhead, staff, and other factors, are different for each location and each physician, and can have a significant impact on costs. So once again, you have to be an informed consumer. Comparison shopping is all right, but just as important is your relationship with your personal physician. Ask yourself these questions. Do you feel comfortable with him or her? Do you like the results you have seen on other patients? Is there a positive attitude in the office and with the staff? These are very important factors. But you can take assurance knowing that there are many highly skilled and talented doctors working worldwide. So now you know the facts. The next step is yours. Go ahead, take it. And here's looking at you.
Dr. Fetter performs all the procedures shown in this video. His fees are highly affordable, and he invites you to visit his Fifth Avenue clinic for a personal consultation. If you would like more information about Dr. Fetter, his treatments, his services, or the more than 120 products Dr. Fetter has created and dispenses to his patients worldwide, please feel free to write or call Dr. Fetter for a free brochure at Louis Fetter, MD, 965 Fifth Avenue, New York, New York, 10021. The telephone number is 212-535-8700.